Hi, my name's Karen Drenkard, and I'm the Associate Dean at George Washington University. And we're doing a series of interviews with chief nurses across the country to hear about how they're preparing and the challenges and opportunities that they're facing. So today, it's my pleasure to be here with Dr. Maureen Sintich, who's the Executive Vice President and Chief Nurse at Inova Health System. Maureen, thank you so much for taking time out of this incredibly busy time and giving us a few insights into Inova's efforts right now. Inova is in a pre-surge preparation time period. Can you just talk a little bit about the challenges that you're facing as you manage that preparation, and what do you see coming up in the next few weeks? What kind of things are you anticipating?
So, as you said, we are in the pre-surge planning phase. We expect that the surge will occur within the state of Virginia in about 2 weeks. And so what that gives us is a critical opportunity and time frame to prepare. We have our nursing teams have been working together. We have been spending a lot of time cross-training. And, this is in really adopting new models of care. If you think about what is old becomes new, adopting the team-based model so that we can ensure that we have the right expertise in the right location to provide care for these critically ill patients, while at the same time being able to meet the needs of all of our patients within the healthcare system. So it's a challenge, it's a balance. Our nurses have been amazing at how they have stepped up their willingness to learn, as well as how they have really kept the heart of nursing at the forefront, and thinking beyond just again the care and the components of the model that are so critical, but also thinking about the human aspects of nursing and how they can make an impact, and just really focusing on what some might think are little things, because again, where we're restricting visiting hours, for example, how do we make sure that people are able to connect with their loved ones in a way that makes sense, that they are identifying activities that can help individuals who are able and capable, so that they have distractions, and all at the same time in taking care of each other as well. So it's been just incredible, the commitment and their dedication to the profession, to the team, as well as how the entire team comes together to do this work.
It seems like you're living Jean Watson's human caring theory. So I don't know if you've seen her wonderful little clips that she's been sending, reminding us that intentional presence is really important, especially because people can't have visitors. So it's wonderful to hear that. So let's just talk a little bit about the workforce. So having to cross-train people, asking them to serve in new roles, just the stress and anxiety of what's going on in their own lives and their families. Can you tell me a little bit about what you're doing? I know that has to be strategies that you've put in place to help manage some of that, but what is working for you to be able to support the well-being of your staff?
Well, you mentioned Dr. Jean Watson, and you're absolutely right. We do ascribe to the theory of human caring within nursing, and we also have a holistic care council that has put together a number of meditations to have those available for our team members. We have been sharing the videos, and they are available not only to our nurses, but any of our team members who have an interest and would like to see the videos. part of what the council has been working on over the past several months is, even under normal circumstances, we know that healthcare can be stressful, and
Right.
caregiver stress is a very real entity in the lives of those who do this work. And so they've been focusing a lot on uh, peer support as well as leader support, and creating a toolkit for emotional first aid and in support for the members of the care team. And so that work will and is continuing. It is more critical right now than ever.
Thank you so much for sharing that. And I was just wondering if you could point to maybe one positive lesson learned, or maybe not positive, but a lesson learned from this time working together. And if you had advice to other nurses across the country that may be a little bit farther behind on the surge curve, what lessons have you learned so far that you would love to share with everyone?
So I think, there are a couple of things. One is that we have learned so much from those who have come through this before us and who have been so open and willing to share. And so, that has just been incredible, given the fact that we know what our colleagues across the country are going through, and that they're certain, it's certain that their presence is being felt because of their sharing. And I know that our patients and as well as our communities will be better for that. And so, first and foremost is to take advantage of those learnings if you haven't already, because I know that, again, I'm sure that everybody has. The other thing that I would say is that innovation comes from all kinds of places and spaces. And it doesn't have to be just from those that you think are the traditional members of the care team, if you will. I'd like to do a little show and tell if I could.
Oh, that would be great.
This is from our engineering team. We wanted to make sure that we had helmets and face masks for all of our caregivers. And, we know that there are certain resources that are difficult to come by. And so what they said, in particular for those that are caring for the COVID positive patients, they said, we can do this. We can make you a helmet with face masks. And so this is what they put together. And I don't know if you can see this.
Yeah.
But they made these so that everybody could have their individual PPE kit on those cohorted units where we're providing care for the patients. And again, not just nurses, these are for the nurses, the doctors, the respiratory therapists, everybody, the techs, everybody who is on the unit providing care for these patients. And, their willingness and desire to be able to contribute in ways that you wouldn't, typically think of, but that, they are making an impact for all of our teams. So I think I wanted to just give a shout out to them, because you just never know where these ideas will come from and the impact that they can make.
Maureen, it's the creativity that comes forward in service to others that was really quite remarkable. And I think, when you think of your employees, you first want to secure their safety. So the gift of them building those devices for them to feel safe, combined with the physical safety, is this sort of intentional emotional safety from the work of the human caring that you've done. So I'm just very proud and happy I live in this community. So I'm just really in awe of the work that you're doing. And I know that there'll be a lot of reflection as we go along, but I'm just very grateful to you for sharing what's happening now, and really would be delighted if there's anything we can do to help you at GW. I know we stand as your neighbors. So thank you so much for sharing what's going on at Inova.